Hey there viewers, did you know that consistent inflammation and loss of cartilage leads to osteoarthritis? Cartilage is really important for your bone and joint health. It's the smooth, rubbery connective tissue covering the ends of your bones. With its main function to cushion joints and to help them move smoothly, cartilage is both tough and flexible. In today's video, we'll be talking about the early signs that indicate cartilage in your body is weakening. Can cracking and popping sounds be a symptom? What about deformities in the knees, as well as pain and loss of joint space? We'll be talking about all this and more. Number 1. Crackling or popping sounds. Have you ever noticed your knees, knuckles, and other joints making uncomfortable sounds? Like crackling, popping, grinding, or creaking? Medically, this is known as crepitus, and it can be a sign that not all is well with your cartilage. You may hear these sounds when you bend down or try to straighten your knees. This occurs when some of your cartilage gets damaged. Because of your damaged cartilage, rough surfaces and bone spurs may develop. This in turn causes the crackling sounds when you move, as the joints rub against each other. Don't be alarmed if you hear crackling sounds and have no pain. There could be an entirely separate minor issue. For instance, a ligament or tendon may snap over a bump. Your ligaments have tightened, and there could be air bubbles inside the joint, causing the pop sound. Another big reason for these sounds might be osteoarthritis, which can be caused by weak cartilage. Experiencing pain and stiffness isn't always the case. Research has shown that 75% of people suffering from knee osteoarthritis experienced grating and cracking sounds that with time progressed into advanced symptoms. So the next time you do hear these sounds, don't shrug them off. Number 2. Loss of joint space. Cartilages are normally found around the bones where it cushions the joints. They don't have any blood supply, so once damaged, the recovery is difficult. This is why detecting damage as early as possible is important. You can also pay attention to the amount of space between your joints to confirm whether or not you really have a weak cartilage problem. In fact, this is a crucial tool that doctors use to evaluate arthritis. Narrow joint space is a telltale sign that your cartilage isn't doing what it's supposed to. If your cartilage is damaged or wearing away, a hollow space will be created around bones. This is joint space narrowing, JSN, and can be easily determined through X-rays. In fact, your doctor will use it to determine what type of treatment you should be given. A study in 2015 reported that joint space narrowing, knee pain, and weak cartilage are all interconnected. When your cartilage is healthy, it makes it easier for your joints to move. Your bones will be able to glide smoothly over one another without any friction because cartilage is there to act as a cushion and shock absorber. But all of this goes kaput when your cartilage is unable to act as a cushion. It can be due to an injury or just wear and tear. Remember, JSN is just the start, so catch the problem in the beginning stage and uproot it. Are you finding this list useful so far? Well, the next point is surely to surprise you. But before we continue, why not subscribe to our channel for more videos like this and hit the bell icon so you're always up to date. Number 3. Knee buckling. Have you ever experienced weak or wobbly knees? As if one or both of your knees just gave up? The knee instability is called knee buckling, and it may be accompanied by pain. You'll be surprised to know how common this problem is. Though it does affect people of all ages, researchers found that around 11.8% of adults aged between 36 and 94 report at least one knee buckling episode every 3 months. Experiencing wobbly knees once or twice because you stumbled is normal, but if it's an everyday occurrence, especially when you're climbing stairs or walking, you need to address the root cause, and more often than not, it's your weak cartilage acting up. There are several reasons for knee buckling. Your tendon that joins the bones to the muscles could be damaged. This will affect the stability of your knee. You may also have experienced a traumatic injury that damaged your knees, making the joint unstable. All of these will lead to buckling and locking. And not just that, but weakening cartilage and rubbing of the joints can also give rise to bone spurs. This gives way to a bumpy surface, causing your joints to lock up. As a result, you'll face difficulties in bending and straightening it out. Number 4. Swelling or tenderness. Unfortunately, your cartilage does not just experience wear and tear. It also can be inflamed, certainly not a pleasant thing to experience. To keep your cartilage healthy, a membrane known as synovium produces a thick liquid. If your cartilage gets worn and torn, the synovium becomes inflamed. The result is the extra fluid joint, which is never a good thing. The synovial thickening along with extra fluid causes swelling and tenderness in the joints. This makes simple movements like walking difficult for you. If your cartilage keeps deteriorating, even the adjacent bones become affected. They won't get the synovium fluid and necessary cushioning provided by cartilage. And when these bones rub onto each other during movements, looks like if you avoid the initial symptoms of inflammation in cartilage, you set yourself up for more joint damage. Before we move ahead, here's a video you might like. Check out the ultimate guide and every vitamin and mineral your body needs. Watch and learn. Number 5. A gradual increase in pain. The good thing about pain generated due to cartilage issues is that it develops slowly, but this doesn't mean that you should take it lightly or ignore it until it starts bothering you consistently. Address the issue when it's starting out. If you have weak cartilage, you'll notice the pain starts as soon as you get up in the morning. Everything from climbing stairs to getting up from a chair suddenly will hurt, and in rare cases, the pain might start without warning. Several people report that pain initially starts with small joints, spreading symmetrically on both sides of the body. You can look for additional signs too. For instance, the joints where you're experiencing pain might become red and warm due to inflammation. Pain caused by weak cartilage is usually aggravated by harsh conditions like cold climate, physical stress, lack of proper exercise, etc. The biggest mistake people can make is that even though the symptoms usually take years to develop, they'll wait until it's unbearable. Get yourself checked as soon as the first symptom shows up. Number 6. Difficulty in movement. Well, if you're experiencing difficulties in movement, one thing is clear: your joints and bones aren't in the best health, and weak cartilage is often the main culprit. It could be an injury to the knee cartilage, making it hard to move your knee while walking, or standing up from a sitting position. If left unchecked, you'll face difficulties bending your knee permanently. Continuous pain and swelling might become a part of your life. Even long periods of immobility and inactivity can damage your cartilage. If you have close relatives or family members with difficulty moving, you are at risk. Genetics play a huge role. In short, stop procrastinating and figure out the root cause of your painful movements. Number 7. Deformities of the knee. Have you experienced weird changes in the shape of your knee? Like something's definitely off about it. No, you aren't being weird. This is concerning because cartilage issues can lead to deformed knees. In fact, if you have deformed knees, there's a risk that your cartilage is damaged to a severe extent. The severity of deformity will depend upon the extent of cartilage damage. But how did this even happen? Well, cartilage issues cause inflammation. When left unchecked for a long period, it causes permanent damage to cartilage and tendons. As a result, the shape and appearance of your knee gets altered. Cartilage issues can also cause the muscles around your bones to shrink, giving your knees a deformed appearance. They may even look like they're pointing at each other or pointing away from each other. In case the cartilage inside your knees wears down, it'll cause your legs to bend outwards. Have you noticed any of these signs? Do you think you have weak cartilage? Let us know in the comment section below. We'd love to hear from you.
Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait! What kind of Bestie would we be if we didn't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.